I'm joined today by Dr. Richard Gilroy, a hepatologist and medical director of the liver transplant program at Intermountain Medical Center in Murray, Utah. Welcome, Dr. Gilroy.
Thanks for having me.
Good to have you. This past year, big news, big headlines when Dr. Starzl passed away, father of transplant, liver transplant. Tell me, what does that mean to you?
Well, Tom Starzl probably is best known actually as the father of transplantation. His pioneer work, directly I can say that as a consequence of him, I actually do this, because I don't think we would be where we are today without his work. He started his work actually at Hopkins, moved his work to the University of Colorado, then to the University of Pittsburgh, and he built the largest liver transplant program in the world, bar none. And the program then actually spawned most of the programs throughout the US and in many countries of the world. And I can think now in Australia, the liver transplant program in Brisbane, where Steve Lynch is the current chair of surgery, he came from there. He was trained at the University of Pittsburgh. When I look at the Karolinska Institute, when I look at University of Colorado now, today, all of these programs have descendants or indirect 1 degree of separation descendants of there. So mine, Steve Lynch, to Dr. Starzl. But what did he do? He never questioned how hard one had to work to achieve the objective. He was a person who, as recounted by Charlie Miller, could actually, into a dictaphone, dictate an entire manuscript and recall all of the references and all of the elements of the references without having to refer to a book. Wow. He was a person who inspired in all of those around him because of his tenacious nature in approaching the clinical problem of people dying with liver disease. He became an example of how hard we must work to make changes that will save lives. And ultimately, if we look at the great advances in liver transplantation, they're all directly or indirectly related to him with 1 degree of separation. Living donor transplant, split liver transplant, primary liver transplant. He was the first person doing it successfully. The liver transplant moratorium, where they re-evaluated what they needed to do. But bottom line, when I listen to everyone talk about him, and I think about one of my great friends and mentor, John Fung, reflect upon Tom Starzl, he was a person who no one could ever be like, because he is a person who truly dedicated his entire life and mission to addressing the greatest problems in transplantation. And for me, fortunately, in liver disease, our primary focus was liver transplantation.
An amazing legacy.
Mm-hmm.
Another big name here at the conference this year, Dr. Newberger, gave a presentation on the rules of transplantation. Tell me what you took away from his presentation.
It's interesting. So we've talked about Tom Starzl, who challenged all the social rules, or at least the rules of what we think we should or should not do, and he developed great advance by basically questioning and moving forward. Dr. Newberger moved the needle further. And what he's asked us is, when should we be considering what we should do? And often we actually run into that in our daily lives, because we have patients who now, because of the way we allocate organs, are critically ill. And when can it be that a patient is too ill? And similarly, another question that could be raised about it is, when do you consider transplanting people with certain disease states like active alcohol? Is it appropriate to move in that direction? Or should we have some standard rules that we all agree upon? When we prioritize renal failure, we actually end up doing more kidney transplants with liver transplants. Do we know who we should be doing both with? Another rule that we need to examine. But the other part about the rule is our ethical responsibility as custodians of a resource. And when do we start talking about things about utility? So liver transplantation is not prioritized around utility like a kidney. And utility is the review of getting the greatest mileage out of the organ that is allocated, whilst at the same time saving the most lives. We do not prioritize young donors to young recipients and older donors to older recipients, we actually prioritize livers that the next liver, and if you're the sickest, you receive it. And introduced food for thought today was what I would say. Dr. Newberger's talk made me think. And with this thought comes discussion with other individuals after that talk. And I think that as a collective, the transplant community now realizes that we need to, or at least start needing to talk about utility in transplantation. And so that'll happen. This meeting's been critical at bringing very, very, very influential minds and brilliant minds together to discuss opportunities that we have. And I'm looking forward to next year's meeting, which will be, I am absolutely certain, better than this one.
Great. Well, thank you for joining us today, Dr. Gilroy.
Thank you very much.